Dr. Chris Brandt received his DVM from UC Davis in 2001 and a master's in medical informatics from Davis in 2003. He leads a small team of awesome developers and designers who create awesome things for the school. His primary IT interests are in mobile computing and systems that cross educational and administrative boundaries. He's currently the co-chair of a committee exploring the future of the UC Davis Hospital Information System. So Chris, when you're ready, please move forward.
All right, thank you very much. How's my audio sound? Excellent, excellent. All right, so I'm here today to talk to you about what we've done competency tracking-wise at the vet school. We started off a long time ago looking at our options for how we wanted to track competencies because the Council on Education basically said that we needed to. We also wanted to be able to know what are the things that our students are doing, and it's not just because we're being told we have to, but because we want to know how our students are doing and what our students are escaping with. At the time, we looked at the commercial options from eValue and 145, and based on what they were able to do at the time and the cost, as well as the additional integration needs that we would want to work with them on, we decided that it was more effective to build a system ourselves. So, starting actually in 2006, we've been undergoing a curriculum change, and there were many meetings, many committees, many faculty involved for many, many hours on what is it that we want to be able to track, what will these things look like. In 2008, we started requiring gathering the requirements for what the didactic portion of a competency tracking system would look like. What does it need to do? And we were looking then at eValue in 145. So we gathered those requirements. In 2009, we started building the system. Competency surveys were sent out to faculty and other stakeholders. Committees met, discussed those, and in September, we first started piloting the CTS didactic portion. Starting in 2010, we started looking at, okay, well now, we want the students to be able to track some of these competencies as they are entering the clinical curriculum and going through their clinical year. Started building that in 2010 and started piloting it in early 2011 for full production in July of that year. In August of 2011, we started the first year of the new curriculum, just as a point of reference, and then started in 2012 trying to figure out what we wanted to do to now be able to assess our students through this system. We've been piloting that started piloting that in 2013, and now we're in full production of that for both didactic and clinical direct assessment. So I mentioned integration. We have had since 2005, 2006-ish a curriculum management system known as CREST. It tracks all of our sessions, all of the offerings for those sessions, the learning outcomes, the disciplines, basically anything that is about a course or a session is stored in there. We wanted to very specifically pull that into, make that available to any type of competency tracking that we would be doing. For the development of the system, we wanted to have varying levels of granularity for this. So we started with a kind of general broad domains. There are about 7 domains. Each of those domains has a number of learning outcomes within the and these are the learning outcomes for the school as a whole. Within those, we have top-level competencies and then some very specific competencies. Here's an example of one, kind of the top-level competency is anesthesia skills, and then within that, there are a number of additional competencies and kind of sub-competencies there. For each of these, the top-level competencies, we mapped those to what the Council on Education said we need to be tracking. And so we have these on the left are the top-level competencies, and then across the top are the COE outcomes. So capturing the didactic encounter. Each of our sessions in our curriculum management system or any of the sessions that we are interested in being able to assign competencies to, we have available within this one system. And then the either our kind of competency tracking administrator, who's Jan Ilke, our associate dean for academic programs, or the faculty themselves, can click through to add specific competencies to the individual sessions. We have approximately 1,000 competencies, so usually the faculty are working with Dr. Ilke on this endeavor. So when you click on select a specific session, you can then see the collection of competencies that are associated or affiliated with that session and add additional competencies. You do a search, you find it, and then you click at what level will the student acquire that competency during that session. We've got 5 different competency levels: foundational knowledge, theoretical knowledge, observed, performed, and assessed. Rather than reading these, I'm going to make these slides available after the end so you can jump through them that way. In order to track, okay, well, we've assigned that for the specific session, the students should receive these competencies, but we wanted to be able to have an easy way to say that this is happening without having a manual kind of check off or a spiral book that the students are having to carry around. And so we've deployed touchscreen kiosks around our facilities that use these Prox card readers, and each of our students has an ID badge that has a RF chip in it, and they're able to quickly swipe into the sessions. So when they walk up to a machine in a kind of non-logging in mode, it looks like this. It's presenting what's happening in that room or that facility for the day. But when you get to a session where you need to log in, it switches over to this alternate mode, and the students can either swipe their badge across the reader, or if they've forgotten their badge, they can touch on this little keyboard icon and punch in their student ID. That's much less efficient though. So that's how the students are logging into their didactic sessions. They have the access to all of the sessions that they've logged into, as well as the competencies that they've gained from each of those sessions that they're able to see. From the clinical side, we knew that we needed this to be very, very efficient because our students are very overworked, like everybody's senior clinical students are overworked. We didn't want to add substantial burden for them. And with close to 1,000 competencies, we didn't want to have them have to know now, okay, I did a SPAY. What competencies am I supposed to document for that procedure? And so we've tied this very closely in with our hospital information system, VMAX. And so the students, when they are the student assigned to a specific case in VMAX, they have this list of the patients or visits that they have not yet imported into the competency tracking system. They can click import all, and it will suck in all of the signalment data, the presenting complaint, clinical diagnosis for these cases. From there, they have the ability to go dive into the specific case and look at any of the procedures that were done on this specific visit. This allows, we've got then a mapping between the many, many procedures and the specific competencies so that they can say, okay, well, this animal was billed for a CBC ChemUA, it had an ultrasound and 3 other tests. And then the students can basically import those procedures and see the collection of competencies that were that are linked to those procedures, and they indicate whether they did nothing, had nothing to do with that, whether they observed that, or whether they performed that. Reporting-wise, so this is a look at a single student looking at the collection of competencies, whether the competency is core, whether it has a specific relationship to a specific emphasis. As in the past, we've had tracking for the students for their senior year, how many times they've done something didactically, how many times they've done something clinically. We also have the ability from the admin point of view to see, okay, what percentage of our students in a single year have done these things. with some color coding to help hopefully get that lots of green for percentage completion of each of these things, especially the ones that are labeled core. We also have, looking at the assessment side, what, for each of the specific direct assessments and all of the, at the top level competencies, how have the students done? And so we're looking at, lots of green dots is good. If a student has a number of red dots, then maybe we help them remediate those specific skills ideally. So I went through that a little faster than I expected. Does anybody have any questions on this? How many people do you have managing this effort? What types of skills do you need on staff, faculty to maintain this program? So I'm the lead and pretty much only programmer on it. The Associate Dean for Academic Programs, Jan Ilkew, is the primary manager of the competencies and keeping those up to date and accurate and current and appropriate. We tag team training of the faculty for the direct assessment portion. We have one person in the hospital who has been assigned the responsibility of checking to make sure that the students in their senior year are actually submitting their competencies and their encounters, and we've built reports to make that easy for her to do. So those are the main things. Is there any way to incorporate basic sciences, or is this only clinical in nature? Some of the competencies they're mainly clinical in nature, but we have tied this into, say, the anatomy labs, where somebody is learning about some musculoskeletal anatomy, that is foundational knowledge for, say, an orthopedic exam or for orthopedic procedures. Do your clinical assessments include rubric evaluations? Yes, very much they do. One thing I wanted to do is I'm going to paste something into the chat. So this is a link, hopefully you'll actually be able to access this, that is to a larger version of this presentation, the 1-hour version that I gave at AVMA, that has a lot more screenshots, including some of those the rubric details. Is there a profession-wide version or analog of your competency? And if so, how closely does your mapping correspond? So this was a number of years to build this collection of competencies, and we've gone back and forth between how detailed do we want, and that's a little too 50,000-foot view kind of stuff. And we've honed that back and forth. We worked with a number of other institutions, and with their permission started with some of their competencies and then modified from there. And so I would need to check with Dr. Ilkew. I don't imagine that it would be a problem to share our competency list, but I would need to check with her. I mean, analog your competency. I'm sorry, I don't understand that question, Andrew. Do UCD have clinical track students? We have up until the class of 2014. The class of 2015 is the first year that our students are not tracking. Competency lists are collected in the novice portal. Excellent. Well, I will, if permission is granted, I will endeavor to make those available through that portal. Okay, well, thank you very much for your attention.